So what are the main questions that you're getting from people over the last 2 days?
Where can I go get
Where
tested?
can I get tested?
Even-
Can I show symptoms or just in
Or
general?
no symptoms, can I just go get tested anyway?
Just to be tested.
They just want to be tested even if they're asymptomatic.
Correct.
We heard a lot of that on the phone, like letting people know who
Thank you
did
so much for being
opt
so
to have
careful.
through their like lab results and everything done through the phone. They were
Yeah.
really grateful that that was an option. And then because they're like, I understand you're not seeing anyone in your office. We're like, well, we are doing the curbside. So if you do feel you need to be seen or something comes up, to avoid going to the hospital where, you know, that's going to be the biggest place where all of this is going to end up, for one.
For sure.
And
Staying out of the ER if you don't really need to be there.
people who need to be there get seen, get treated.
And so it's working well, then it's a good advice for really any clinic to try to do office visits outside in the parking lot in the car if you can, or telemedicine visits via the phone or Skype or however.
So basically, the patients have just been like parking here, and we've just kind of been doing it in order.
Are they using just these spots?
Yeah, basically, and like one person used that, but I mean, yeah, right here.
Yesterday
And
we had
then
over there too.
I've just been telling them like, just stay in your car. I will come to you in just a moment, one at a time, weighing them, doing the oxygen, heart rate, blood pressure, and then back in the car, getting the chief complaint, everything in the car, and then she'll come out and talk to them, go over lab reviews and everything, and then I'll go to the next one, do the same thing.
How's it going?
Fabulous.
It's going very well.
You're glowing.
Thank you.
We've been out in the sun. We have that
Right.
sun-kissed skin.
Stayed out here for a while.
I did hear that it's a good idea if you're sick with a viral illness to get outside in the sunshine. So maybe this is protective.
There you go.
We're trying to take a lot of that pressure off the providers and the hospitals and just say, look, we just need one site. It's still a triage. Anybody that it's not going to be a test all. I'm walking in. I want to be tested to know whether I'm sick or not, or whether I'm infected.
Yes.
It's not. It's you still have to meet symptomatic criteria. And all this is without a positive case. So we're getting a lot of activity with zero positive cases in Marion County.
It's amazing to me that we still don't have a positive.
It's inevitable. You look at the way the virus is and as mobile as it is, I think it's, we and that's what we're planning for. We're planning for the win.
That's what it seems like. It seems like that's actually the case. I was really glad to hear from Mike yesterday and you that hopefully, again, in the coming days, maybe that we're going to have a specimen collection site so people will be able to go get triaged and, if appropriate, then get a collection done. Is that something that they think could happen this week, or is that a little wishful thinking?
I know we had discussions Sunday on it. We had discussions yesterday on it, and we have another discussion today on it.
Okay.
It is priority one right now.
I can see that the health department and the hospitals are working incredibly well together to try to get this up and running, organized, so everybody knows what to do and where to go. And if we all do what we're supposed to be doing, we're going to move through this much, much faster and with much less pain and morbidity.
That's all we can ask for, is we're getting the same message out. Get the constant message out. Get the importance of social distance. Get the importance of these mitigation processes. That's why we're putting them in place, because that's what's going to stop the spread.
Absolutely.
If we're practicing the social distancing, if we're practicing proper hand washing, stay at home when you're sick, cough into your sleeves. And I know people get tired of hearing that. Well, that's the message for everything. Well, it is an infectious disease preventive measure.
Right, it is. There are definitely a lot of people that are really scared of this and they're staying home. There are definitely responsible people that are staying home if they're sick, but there's still so many people that feel invincible to this thing. They say, I'm not worried about it. This is not a big deal to me. I'm going out. That's what worries me.
But I agree with you. It's not the if, it's the when. That's what we're preparing for now. We're preparing for when it happens. And that's, so you talk to Dr. Torres and you can talk to Dr. Osberg over at ORMC. We're all meeting together and having these discussions right now.
I really appreciate the good work of all of you, just as a doctor out here in the field. I know that everybody is working very hard on this. Again, I appreciate your good work.
Sounds good. Appreciate appreciate you, and I appreciate you helping us getting the word out there.
Thank you very much. Have a good day. Okay, that's interesting. So it's just more confirmation that the leaders in the community are absolutely doing their best to stay on top of this. I'm really encouraged. That's good news, but I have some other questions now. So what I'm hearing from yesterday is that people are pretty nervous about this coronavirus thing. How did the calls go so far today? What are people asking about?
Well, today was a lot easier, in my opinion.
What was easier?
The volume wasn't that high. There were, the calls were steady. It wasn't.
So the panic was the Monday panic
Right.
from the weekend
Right.
news.
The weekend, they couldn't talk to anybody. Nobody was open, so they wanted some information. But
Okay.
now that we're giving them that online, over the phone, like there's someone here, to me, it was more steady. It was more, we can handle one phone call at a time.
Okay.
And it's still basic questions. Where can they get tested? Should they quarantine themselves? For how long?
Yep.
What should they take?
Anything we need to change?
No, I have noticed a lot of people are calling trying to become patients.
Trying
We're
to.
having a high volume of, oh, are you accepting new patients?
Do you accept this? Do you accept that? I need to be seen.
What do you make of that?
I think people are panicking and now need a doctor.
Yeah, they're just concerned and want a doctor.
Some
for
People
just
that don't
in
have
case.
doctors
Exactly.
or don't have
Self-pay.
PCPs.
Yeah. Yeah.
So we're seeing higher volume for people that maybe
Just
don't have a
never.
doctor, never established with a doctor, and now because of this is happening, they're
They want
wanting
it.
to be sure
Yeah.
that they get
There are
with
a
a
few
doctor.
self-pay that we're asking.
Good work.
Thank you.
Hmm.
Thank you. Oh, that one's too sticky. There you go. Look.
This is a new thing that we're gonna do here.
Oh!
Wait, ready? Okay, go. Here we go. Now there you go. That's the new fist bump. It's the hand sanitized fist bump. Okay, we have to divide and conquer. We have many questions that were unanswered from yesterday. Number one, I was talking to the epidemiologist for the county, and she said that there's a public information officer. Her name is Christy Jurgens. Did she call back?
She did. She called while you were on the phone with Mark Lander.
So we'll call her back again and see if we can get her on the line.
She called on a two-way with Maggie.
Hey, did we hear back from ORMC, Megan? No. So we need to get infection control at ORMC on the phone. I have a contact, Christopher Moore. I don't have a number for ORMC or 401-1000. Thank you.
You're welcome.
Okay, this one's for you then.
Okay. Go.
The County Emergency Management Center, run by the Sheriff's Office, apparently has N95 respirators, masks, gowns available for people that need them, or for offices that need them.
Okay.
So will you call them and find out if that's the case and if we can get a supply of those, maybe 25 of everything? That's all.
Okay.
Hey, you don't have a fever, do you?
No,
Cough?
nothing. Elbow.
Okay. A good man.
We're a high complexity lab. We do
Yeah.
a respiratory panel, and then we've added COVID-19 to it that's approved through the FDA to answer the question quickly and to the point.
How do we get kits? What's the
We take care of all
turnaround?
that stuff, 24-hour turnaround time.
Any insurance, or how are they dealing with billing?
Insurance, we take care of all that stuff for you. So
Just like a rec form?
it's a rec form.
We
that you
fill it out?
Exactly.
So what we're working on right now, we don't have any N95 respirators, and so we're working
Right.
on getting some. So we
Gosh.
can do the testing. So we're gonna see if we can get our hands on any. And then if we can get our hands on some, I've got a couple of kits from, Quest and LabCorp. Doesn't matter to me. I'd rather help a neighbor than,
Right.
How about we get in touch with you if we can get respirators and get the PPE equipment?
That's fine. That'd be great. Appreciate it.
Thank you.
I left him a message. No one answered.
You left who a message?
Christopher Moore.
This is infection control at ORMC?
Yes.
Left him a message?
Yes.
You got his voicemail?
Yes. Well, it was
Or is-
Becky and Chris.
Okay, yeah, I think I left a message on that one yesterday.
Okay.
So we'll see if we get a call back on that one today as well. It's hard to get somebody from ORMC on the
From there,
phone.
yeah.
Updates.
Updates.
Who do you have?
I have County Emergency Management, Robert Sullivan. They do not have any N95 respirator masks. They have no shields. They have no gowns. They are supposed to be getting some. but he had me email him because he's going to send a form that you have to fill out and make a request that has to be sent into the state. And it has to be triaged on state needs. And he said, unfortunately, since there are no confirmed actual COVID viruses in Marion County, that we are on a low critical need status at this time.
It was my understanding that the county had a stockpile of N95 masks.
According to him, no.
The county doesn't have N95 respirators available.
No.
So I need you to find us some N95 respirators. See, we're trying to do testing here at Trinity. We have the kits, but we don't have the PPE, the personal protective equipment, to do the testing here. So we need to get our hands on the equipment. So who can we get this equipment from? This is a tall task. Will you please find me 25 N95 respirators?
Of course, Dr. Kuhn.
Thank you.
You're very welcome. Next.
This is hard.
It's very hard.
I can't believe they don't have respirators.
They don't. They're supposed to be getting them, but nobody's going to tell you when.
Okay. So we don't know.
Critical need.
Low critical need. Hi, ay, 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 ay. Whoa, wow, there's a lot of action happening in there. Are we almost done?
We're waiting on that 4:30 patient that I cannot get a hold of.
What time is it?
3:50.
So there's no N95 respirators available at the emergency supply center for the county. Okay, what else do you have?
Your interim city manager, Sandra Wilson.
Yes.
She was unavailable, but I talked to Kat, her secretary.
Okay.
There is currently no list of any business closures except for what was listed in the star banner for the bars and the restaurants closing at 5 p.m. There's no official list anywhere.
Okay.
What you see and what you hear, star banner.
Pretty much what we go.
Yeah, the restaurants, the bars. Today they're closing at 5, but that's it. There's no official list.
Has anybody been to any grocery stores in the last day or two?
I'm going today.
You went to Sam's last night? What did it look like in Sam's last night?
Empty.
I got a photo.
You have a photo of Sam's?
I went to Wendy's.
Publix is
Shelves
limiting
are
everything.
bare. Yeah,
I
you can
heard
get two.
you can only buy two. You can only buy two of anything.
Yep.
Everything is limited.
Even cans.
So you can only buy you can buy 2 cans of corn
Yeah,
and 2
2
cans
corn.
of 2 cans of lima beans and 2 cans of baked beans.
Everything is limited.
Not
Went
just-
from 4 to 2.
Oh, it was 4?
It was
Now
4,
it's 2?
Now it's 2.
Okay. Yes, there's no need to be hoarding all of this stuff. Oh, Sam's Club is
Forget about the
very
toilet paper.
busy.
Yeah. Yes, they had lines on Sunday down the aisles.
Wow. Is that you?
Yeah.
What did you buy? Look at all those mountain.
I don't drink soda.
I don't drink her cart.
No. That was me and my dad. Me and my dad went.
So, but it's not empty though. There's no restrictions for what you can buy. So, still good at Sam's
No, we bought a
Club.
ton of stuff.
I mean, you can buy waters and was there a line out the door or anything last night?
It was very long. And then this morning I saw on Facebook that people were like lining up with their buggies,
All right. So you
Outside.
you can still buy in bulk at Sam's then.
carts.
There's nothing out in Dixie.
There were
nothing at the dollar stores.
Like empty.
Empty. No bread.
The shelves are empty.
Milk.
Publix
No
is there.
water.
Which Walgreens did you go to that was empty? The Silver Springs one is empty. See if we can stay on top of that a little bit as well.
Yeah, Walmart's bad.
This is Walmart. Which Walmart is
Oh
this?
gosh, I don't know, I have to see.
Hey, can you get that? That's the frozen
Got it.
food section. This, the middle one? Yeah, kind of, right?
My goodness.
Okay, so the reason that this day was frustrating for me is that I would like to try and do the testing here, at least to have it available for our patients at a minimum. We don't have the personal protective equipment, as everybody knows. There's no N95 respirators available in the county for us to get. So we're going to see if we can track down some N95 respirators and masks, gowns, etc., so we can start to do the testing here. I did get confirmation today. I spoke to Mark Lander, who is the administrator of the Marion County Health Department, top dog. And he confirmed that the 3 big hospitals in the area and the health department are in collaboration to create a specimen collection site, is what they're calling it. It's something that might even get up and running as early as this week. They don't know the details yet. They're actively working on it. I'm happy for that, actually. I'm glad to hear that all the hospitals are getting together, even though a competitive thing there, obviously, but you know, this is bigger than competition, and so that's a good thing to see. We're going to stay on that daily, because the minute that that thing is up and running, or that they have a date on when that thing might be up and running, so I'll keep everybody in the loop on that. Also frustrating, I couldn't get any good information out of ORMC about the number of beds that they have, ICU beds, if they have a plan for expansion, what they're doing for the testing right now. So we're going to stay on that tomorrow, see if we can get more information about what's happening at RMC. Infection control, we'll see if we can stay on them. Maybe you'll get a call back. Our day one video is being pretty well received, and so we'll keep this up every day, because I think this is really helpful for people to sort of know what's happening behind the scenes and in the trenches, on the front lines. I want to invite everybody that's watching, anybody that's watching in the community, to ask us questions so we can get to work for them. So I think in the coming days, our audience will grow, and we'll be able to get this information to as many people as we can. So it'll be a good hub. So I think as the days go on, we're going to have to be more and more and more on our A game about responding to the community, as well as keeping the clinic running. Everybody's doing an awesome job. There is not another team I would rather be doing this with than you guys. Yeah, I know.
I was waiting for somebody to make a noise.
Okay, so let's get
You too.
any questions. All right, let's break. We'll see everybody tomorrow.